Interventional radiology is a very advanced branch in medicine which is basically dealing with vascular diseases primarily and some non-vascular diseases. So what is interventional radiology is all about? It's like, if we want to understand in a very common terminology, we are like medical plumbers who can get inside a blood vessel and we can travel from one part of the blood vessel to the other part of the blood vessel and treat different vascular pathologies. Our strength is basically we can occlude a blood vessel which is leaking, or we can open up a blood vessel which is basically occluded or closed. Hence we can treat various diseases. So now, for example, we will be wondering like what we can treat by closing or opening a blood vessel. For example, a patient is suddenly having an occlusion of the blood vessel, blood supply to the brain at the level of carotid or inside the cranial circulation. Patient will end up in stroke. Then an interventional radiology is called to treat the stroke, where we can go inside the brain and we can take the clot out, hence treating the stroke. A second example, for example, there is a sudden bout of vomiting of blood or coughing out of blood, which is called a hemoptysis. Then that can be also treated by interventional radiology. Basically, we can go from the groin or from the radial artery, we can examine the blood supply to those areas which are bleeding, and we can selectively embolize those and close those and treat the disease. Another common example can be, suppose a lady after giving birth to a child is bleeding heavily, which is called a postpartum hemorrhage. Then we can get inside the uterine artery and find out the bleeder, and we can embolize, hence treating a very life-threatening condition as a PPH or postpartum hemorrhage. And similarly, whenever there is a peripheral arterial disease patient where the arteries supplying good blood to the leg is occluded, then we can go ahead and do an angioplasty, open up the blood vessel, hence we can prevent a gangrene or a limb loss or a kind of claudication. So these are the different applications that we have in interventional radiology. So right from the brain to the neck to the chest to the abdomen, pelvis and the legs and even the arm, where the patient comes to the brachial artery occlusion or radial artery occlusion because of thrombosis, then an interventional radiologist is again called. Another big branch where interventional radiologists are doing great work is the aortic diseases. So if there is an aortic aneurysm, be it in the arch or the thoracic region or the abdominal region, the aneurysms of the aorta is better treated by endovascular method, where interventional radiologists are doing great work. So there are many more applications have now come up, even dealing with the tumor in the liver or a prostatic hyperplasia, which can be treated by embolization nowadays. So these are the various applications we can have in interventional radiology. And the best thing about interventional radiology is they are minimally invasive. Most of the time the patient can be admitted within 24 hours, the treatment can be done and the patient can be discharged within 24 hours. Like a varicose vein treatment or like many other daycare procedures that we can do, which needs admission for about 24 hours. The other big advantage of interventional radiology is we don't really cut or stitch. We just make a small puncture in the groin, sometime in the radial artery, sometime in the brachial or direct carotid puncture, hence we treat the diseases. So the cutting and stitching part is almost never there. So the tissue handling is less, hence recovery is faster. So interventional radiology offers the very fast, very quick treatment, daycare procedures without any cutting or stitching. So definitely it is the preferred method for patient for treatment of various vascular elements. Thank you.